What's the changing landscape of the terminology? This was primarily introduced by the committee that worked for the Institute of Medicine, an important think tank based in Washington, D.C. They published this monograph called Epilepsy Across the Spectrum, 2012. And there are a couple of things we all should know. One is the committee really wants us to discourage the use of the term epileptic. People like to think of themselves as a person with epilepsy, not an epileptic. We're not even supposed to say anti-epileptic drug. We're supposed to say anti-seizure drug. You know, it used to be anticonvulsants, but then it was recognized that not all seizures are convulsive, so it got changed to AED, anti-epileptics. But that epileptic has kind of a negative connotation, so now we're using anti-seizure drugs. The problem with that is if you abbreviate it as ASD, everyone in medicine thinks it's atrial septal defect. We think it's autism spectrum disorder. So the abbreviation is still a problem, but you will see in the new Swayman, which is coming out very shortly, the 7th edition, they added 4 new editors, and I'm one of them, so I know. We've changed the AED to anti-seizure drugs. Anyway, so the committee wants us to change the name. So what's in and what's out? What's in now, person with epilepsy, not epileptic. Epilepsy, seizures, that doesn't roll off the tongue. Anti-seizure drugs. Another big change that I did talk about a couple years ago is we no longer say partial seizures. We're really supposed to wipe that out of our lexicon. You know, it's kind of like pregnancy. You either are or you aren't. You either have a seizure or you don't. So it's not a partial seizure, it's a seizure. But we say focal onset because that's what we mean. Therefore, they had to eradicate the term complex partial. In other words, a focal seizure with alteration of consciousness. So there's some debate about that term. A lot of people are kind of using this focal dyscognitive. It hasn't really caught on. That's still evolving. Infantile spasms certainly can occur after a year of age, so now we call them epilepsy or epileptic spasms. Still not quite working. If you have a patient under 12 months of age and they're having spasms, it's perfectly reasonable to continue to say infantile spasms. But after a year of age, we're saying epileptic spasms. Then we get back into the epileptic, but it works. The biggest change is the cause, the etiology. You know, these terms idiopathic meaning unknown, symptomatic meaning there's an underlying encephalopathy or structural lesion or metabolic disorder that the seizures are symptomatic of. Cryptogenic, cryptos from Greek, I'm pretty sure, means hidden or occult. You assume there's a cause because there's something wrong with the patient, but you can't find it, so we call it cryptogenic. These terms have been thrown out. And the new terms, which are on the left side of the slide, but should not be exactly conflated with the terms on the right, are genetic, structural, metabolic, and unknown. It's a little better. I don't know that it's a lot better. Genetic. There's so much of epilepsy that's genetic. This is not exactly new. Hippocrates, whether that was a single physician or a large group of physicians, most people now say, the medical historians say Hippocrates was a whole class of physicians, not one individual. But they wrote about epilepsy being genetic, so it's not exactly new that epilepsy is genetic. And William Lennox, who founded the seizure unit here at Boston Children's Hospital in 1944, and he was president of the International League Against Epilepsy for 15 years. He was the first president of the AES. He wrote about epilepsy being heritable, which got him into some trouble in terms of the eugenics movement. But he recognized the heritability of epilepsy. So we've known epilepsy is genetic, but now we know a whole lot more. And the whole idea of genetic being inherited versus not inherited, well, a lot of education has to go on with patients because a lot of these mutations are sporadic. They're not exactly inherited. But anyway, we talk about genetic, structural, metabolic, unknown. So that's the new classification for the etiologies. Big change here is if you've had one single seizure, but it's clear there's a probability well over 50% that you're going to have a second, you could say epilepsy. If based on that patient's presentation because of an underlying problem in the brain and they've had a seizure, the EEG shows a certain pattern, whatever data you come up with, now it's a little unclear what constitutes that data, but it is fair to say that a single seizure and a clear-cut high probability of more, over 60%. Now, you know, if you've had one seizure and you're otherwise okay, what's the chance of a second one in the next 5 years? It's about 40%. If you had two, then we're up to more like 60% for a third one. So it's a little bit equivalent to saying somebody's had one, but you already, they're sort of like the person who had two, you know they're going to have three. That's where this is. It's a little murky, but you don't have to have more than one seizure anymore. before you can say the person does have epilepsy. I think what's very helpful is the committee defined when epilepsy is resolved, when you can say it's over. Remember in medical school they said if you're 5 years cancer-free, you don't have cancer anymore, and that's gone out the window because it doesn't work. Anyway, there has been this decision that if you've gone 10 years without a seizure, and the last 5 years, well, no meds, your epilepsy is resolved. You can tell someone, hey, it's no longer part of your problem list if you've had 10 years without a seizure and you've gone 5 years without any medicine. Or you have one of the age-related syndromes, like a benign Rolandic epilepsy, where we really, really don't expect to see another seizure after the age of 14 years. So a person has hit 14 years, they haven't had a seizure for quite some time, you can say it's resolved because they're almost past the age. On the other hand, we know that a lot of patients with absence epilepsy do continue to have seizures past adolescence, which was not as well recognized in years past. Now, status epilepticus is undergoing some important changes, and I thought I'd bring this out to this group. So status is defined in this funny way, a seizure that shows no clinical signs of arresting after a duration encompassing the great majority of seizures of that type in most patients, or so-called serial seizures, recurrent series of seizures without interictal resumption of baseline function. A little bit confusing. The basic definitions are 30 minutes for established status. And by 30 minutes, we mean when the seizure starts to 30 minutes later, even if they haven't seized the whole time, if they haven't recovered in between, that still counts as status. That's like serial seizures. That's still status. So if the clock hits 30 minutes, that's established status. But we use 5 minutes as impending status. Once a person's been seizing constantly or intermittently and hasn't recovered for 5 minutes, that operationally becomes status. There are important reasons for that. Why was the 30 minutes selected as 30 minutes in the first place? Because the mortality changes dramatically. If you look at all ages, but I'm not including febrile seizures, a seizure that's less than 30 minutes has a pretty low mortality risk, but it jumps up to 20% for 30-minute seizures. So that was sort of the standard traditional way of thinking of why they say 30 minutes, why we say 30 minutes. And it's also known that the pathophysiology changes. At about 30 minutes of seizing, the compensatory mechanisms where your blood pressure is kicking up, your sugar's going up, all those things start to fail. And there's evidence for irreversible neuronal damage at that point. The problem with 30 minutes is we miss this window of opportunity to intervene. So 5 minutes has become operational because there are other studies showing that if a seizure lasts 5 minutes, it has a much higher propensity to keep going before 30 minutes.